So good morning, everybody. A very warm welcome to UCL Medical School's Open Day this year. It's great to see that you're here. We are looking forward to presenting a little bit more about UCL Medical School, about some of the entry requirements, but also to talk to you or to at least allow you the chance to ask some questions about the process of admission to UCL. It's great that so many of you are wishing to study medicine. My name's Sarah Bennett. I am the admissions tutor for the medicine degree programme at UCL. I'm also the deputy programme lead, so get involved in lots of aspects of the programme. I'm joined today by some colleagues, but also by some of my medical student colleagues as well, who will be able to answer some of your questions. If you would like to ask a question, please do so in the Q&A at the bottom of the screen, where you see there are two speech bubbles. That's the Q&A and where you will receive some answers. Some of the answers will be typed and some of the answers will be given to you live when we do the Q&A. So to begin with, we'd like to know a little bit more about you. So I'm just going to share my screen with some questions for you. So if you can go to www.menti.com and enter the code 17525315, and we'd love to know a little bit more about you. So there's also a QR code that is available there as well. So if you want to scan that QR code and use your phone instead, please do so. So where in the UK or where across the world are you joining us from today? So some from London. Yep, I'm in London too. From Thailand, excellent. Indonesia, Colchester, Malaysia, Liverpool, Staffordshire. Fantastic. Northern Ireland, lovely, welcome. So quite a few joining from London this morning. So anyone in the UK, I hope that you're doing okay with some mock exams or the lead up to your A-levels, and likewise overseas as well. Hong Kong, fantastic. Leeds, lovely. So we've got people from all across the UK and in fact all across the world. That's fantastic, welcome. So the next question. So I know that lots of people think about medicine quite early on in their school career these days. So what year are you in? Some of you may well be in year 12. Absolutely, most of you in year 12. Year 13 may well already have made that decision. Some of you might be on a gap year, or some of you might be graduates, in fact. So it would be good to know. So most of you are in year 12. Excellent. So I hope that those A-levels or IB are going well at this stage. Welcome to the person in year 11. Great to start thinking about this early so that you know the process. And hello, year 13. Goodness, nearly at exam time, but welcome. So when did UCL begin training doctors? So some of you that might have had a look at our website might have known this already. You might not know at all. You can have a guess. Wow, so you all might be actively looking online at the moment at what's on our website, but you are absolutely right. We started training doctors in 1834. The other dates that are on that slide are very relevant. So UCL Medical School itself is made up of 3 London medical schools that have all joined together. So the first one was the Middlesex Hospital Medical School, which was in Bloomsbury and was opened in 1746. And so the hospital itself trained doctors in the hospital. In 1826, UCL opened. And so you opened as a university. It was one of the first ones outside of Oxford and Cambridge. And it was one of the first universities to accept students regardless of their background, which is a value that we are very proud of and that we wish to continue today. In 1834, University College Hospital was built next to UCL on the other side of Gower Street, and that's when the students who were at UCL had somewhere where they could train in a hospital, and it was the first university hospital collaboration. In 1987, the Middlesex Hospital Medical School and UCL Medical School merged. And then in 1998, the Royal Free Hospital Medical School also joined. So the three medical schools are joined together now, and we have a university society, the Royal Free University College and Middlesex Student Association, that has been formed as a consequence. And so you may well know that as RUMS, you may well see that on our website. And so, are you thinking about applying to medical school? So many of you may well be. Brilliant, yes, 10 out of 10, fantastic. You're definitely going to apply. Some of you may well still be thinking about it. You may well just be getting some information at this stage. You may well have some other thoughts on your mind about whether it is the right career for you. And obviously medicine is a bit different because you're applying for a lengthy course, longer than any other undergraduate course. A course that allows you then to go on and be a doctor. So it's a vocational degree program. So it does require some thought before you apply to medical school. And so you're doing absolutely the right thing by being here today and finding out some more information. So thank you very much for that. So I'm just going to swap on to my slides now about UCL Medical School. Super. So welcome to our open day. So the UCL doctor. So we feel that we have a particular brand of graduate that comes from UCL Medical School. We're very proud of our graduates, and we feel that they are highly capable doctors, that they are patient-centered in their outlook. They're equipped to practice medicine in a professional way, in an inclusive way, and in a sustainable way. So we are thinking about the 2030 doctor and beyond now. What will medicine look like? What will our population look like? And how will the planet look like? That we all need to be considerate of. And at UCL, as a research-based institution, we ground our students in science and best practice. And so that's the doctor that you will become by coming to UCL Medical School. Why we feel you should come to UCL. So it is ranked highly. And so across the world, it is a prestigious institution. It's ranked 6th in the world and 1st in London in the most recent QS rankings that came out this year. We've educated doctors for a very long time, so we do have a background of history here. And we produce 350 distinctive UCL doctors every year. And so one thing to bear in mind is the size of the medical school that you are looking to study at. We're quite a large medical school in the UK, not the largest, but it does mean that you would be coming to a cohort of 2,000 medical students across the 6 years of our program. We have many students who go on to graduate and do fantastic things to become leaders in the profession. And in fact, 6 former students and staff have been awarded Nobel Prizes. And our program is a 6-year program. So we have a compulsory integrated Bachelor of Science degree that all of our students will take in year 3. So you gain 2 qualifications. The MBBS that allows you to study medicine and is a primary medical qualification that allows you to apply to practice medicine in the UK. And you also get the Bachelor of Science degree. And we feel that that brings some extra skills and development that is vital for your future career. So what is unique about UCL? So there are over 44 different medical schools in the UK. Each and every one of those medical schools is excellent. It will provide you with a fantastic education. It will award you a primary medical qualification that allows you to work in the UK. However, each medical school is slightly different, and it is worth doing some research about which medical schools you'd like to apply to. In the UK, you can apply to 4 different medical schools. And so it's worth thinking about things like the course structure, the location, the kinds of teaching styles. So we are in central London, and that does bring with it the means to learn from a variety of different people in lots of highly regarded hospitals and tertiary referral centres, where you will see a wide variety of different conditions. I trained in London, I trained at UCL, and I really do think it's a fantastic place to learn medicine. The course structure is relatively unique to us. We have early years medicine, which is science grounded, where there is some early patient contact, and we are preparing you to take that IBSc in year 3. Then in year 4, 5, and 6, most medical school structures are fairly similar in terms of an apprenticeship model of learning how to practice medicine. We have a wide range of integrated BScs in year 3, around 20 different clinical and non-clinical BScs. And we also have an integrated MB PhD program. So some students do wish to take their scientific endeavour further and wish to study for an extra 3 or 4 years in the middle of their MBBS program to gain that extra PhD qualification. So you can spend 10 years with us if you wish. The UCL in itself is a large institution. It's multi-faculty. So we teach here at UCL humanities, languages, sciences, arts, and education. And it means that you will be mixing with students from all sorts of different backgrounds. It's a very international university. A lot of international students come to study on those other courses. And there are 44,000 undergraduate and postgraduate students here at UCL, so wide range of people that you will be mixing with. UCL does have a strong research reputation. There's not a day that doesn't go by where you don't see a UCL academic member of staff in the news talking about their research and expertise. And we really value that, because it means that you will be taught by those academic members of staff and those that are at the forefront of their research career. And at the end of the day, our medical school is all about our students. And as mentioned, the Royal Free University College and Middlesex Medical Student Association, RUMS, is a family. It is a community of practice, and we're very proud of the fact that our students help each other through the programme. My goal as admissions tutor is to take an intake of students and to exit the same number of students at the end of the programme as our future UCL doctors. So this is a diagram that depicts our course structure at UCL. This is actually freely available on our curriculum map website, so you can look this up online if you would wish to. So this is what all of our students refer to. So in the early years, we have the fundamentals of clinical practice. So we are preparing you. Most medical schools curricula are a spiral curriculum. So you will learn the basics, and then you will continue to add onto those basics about how the body works, and then how it doesn't work and how it goes wrong, to learn how you can pick that up and how you can put that right where possible. So in the early years, you will have a systems-based course. So you can see there that you will have systems such as circulation and breathing, where you will study the physiology, the biochemistry, the anatomy of the heart and the lungs in one module. And within each module, you will then get that grounding of research-based practice. In year 3, you'll move on to the integrated BSc program. And so all students except our graduates will choose to study one of those programs. I've just given a selection there on the slide, but you can have a look on our year 3 website, which lists the IBSCs that were on offer this year. The offering does slightly change every year, and so do keep up to date with that. But you can choose from things like clinical sciences, global health, immunology, neuroscience, maths, computers and medicine, oncology, primary care, psychology, or women's health. So there is always something for you to choose from. And that gives you the skills such as research-based practice. You will do a research project, academic writing, literature review, and thinking about evidence-based medicine. In year 4, 5 and 6, as mentioned, is an apprenticeship. You will see there that there were a vast array of different modules that you will cover. And those are all compulsory modules. So every part of the MBBS program is compulsory. Your clinical placements in the year 4 and year 5 are mostly based about 3 or 4 different main hospital sites: University College Hospital, the Royal Free in Hampstead, the Whittington Hospital in Archway, and Barnet and the North Middlesex Hospital in North London. But also along that, there is lots of community-based practice, general practice, and you also have the opportunity to go to hospitals outside of London called district general hospitals like Luton, Basildon and Watford. And in year 6, you will spend 16 weeks in one of those hospitals doing your assistantship. In year 6, you also get the opportunity for an elective, and you also get prepared for clinical practice after you've sat your finals. Across the whole program, we have vertical modules called clinical and professional practice. We're very proud of the fact that we do have a good focus on these particular subjects, because it's vitally important that you are socialized into the profession and that you think about things like ethics and law, patient safety, patient experience, social determinants of health, and professionalism. And you will study those throughout the program. And all of those modules will lead on to the medical licensing assessment at the end of year 6. That's currently taken in March of your final year, and from 2024 onwards, every medical student in the UK will sit that national licensing assessment as their finals assessment. So the teaching styles that we have at UCL, so every medical school will have a variety of teaching styles. Most medical schools aren't one particular style. So we have a lot of large lectures. That is a really good way to have experts coming in to talk to a large number of students, to provide you with all the same learning experiences, and for you to learn how to be an independent learner. Lectures have a really good way of you being able to gather some information and to then go on and be inspired to do some wider reading. So we will continue to do lectures in person on our program. There are some asynchronous sessions, so recorded sessions, but also we do some synchronous lectures online as well. And that is to allow you a little bit of flexibility in your learning. We've learned a lot from the pandemic, and we now know what works best. There are lots of small group teaching activities as well across the program. You'll have 2 or 3 of those sessions every week, where you have your clinical and professional practice, where you might have a student selected component. Anatomy teaching is also taught whilst in a big classroom, will be in small groups around the donor. And you will also have some tutorials. There is community-based teaching in the early years, and we do bring patients into lecture theatres and small groups to talk to you about their experiences. And we do some practical-based teaching and clinical skills, so that you learn how to take blood pressure, you learn how to do basic life support, you learn how to examine each of the systems during that systems-based learning. Anatomy is still taught by full body dissection at UCL, but we also have prosection teaching and imaging. We also have an extremely large iPad called an anatomage table, where you can also learn visually about the human body. Year 4 to 6, as mentioned before, is mostly in the clinical setting, where you will learn how to prepare to practice as a doctor. Our assessments are consisting of two types. One is a written applied knowledge test, and the other one is a clinical and practical skills assessment. And so those two types of assessment are done at the end of each academic year and are for progression to the next academic year. We also have a portfolio of activity that you do throughout the programme, and we also have formative assessments that are done throughout the year to help for your learning and to help you prepare for sitting those exams. We do take support and wellbeing extremely seriously. There's no doubt that post-pandemic, it's been very, very difficult for people to transition back into in-person teaching and to have gone through the isolation and adaptations and changes that have happened. But also it is tough coming to university, coming to a large group of individuals and starting over again. And so we appreciate that and will provide you with support. All that we ask of you is that you work with us and that you tell us when you have some difficulties, because we would really like to be able to help you. You'll have a personal tutor allocated. You will also have a transition mentor, a year 1 or 2 student, or even year 3 or 4, who will actually guide you in that first term and meet with you and help you understand what you need to know about the course itself and their experiences of being on the programme. We do have student advisors who will help you, and we have MBBS tutors who know the course well and can advise you about your approach to the programme. But there are also a wide range of other activities as medics for medics, welfare services, careers advice, financial advice, and we have a 24/7 student support line at UCL as well. The diagram at the bottom there is of our student centre. It's a brand new student centre. It's got 7 floors, over 1,000 study spaces, and is a fantastic place for you to seek advice and help. We do also have, on occasion, some animals coming in. We have pet therapy, which we really enjoy, I really enjoy, where you can perhaps hold a bunny rabbit for a day or two. So hopefully now that I've convinced you that UCL is a fantastic place to come and study, I'd like to now tell you a little bit more about how to get into medical school. It is competitive, I will say that. Medicine has far more applications across the UK than it has places. And those places are capped by the UK government, which means that we do have to adhere to the number of places that we have on our website. And so you do need to think about your application. You need to think about how best to prepare for it. And it is a step-by-step process. So it should begin with some preparation, with some wider reading about the profession to understand what it is like. Perhaps you might want to read a book or a blog, perhaps by a doctor, to give you an idea of how medicine is practiced in the UK, but also across the world. To gain some work experience, which I will talk about a little bit later on, to make sure that you've sat the right GCSEs, that you've achieved the grades that you need. If you have not achieved a grade 6 or above in English language or maths, you are able to resit those alongside your A-levels. And those are the only 2 that we require at UCL. And to make sure that you're sitting the correct A-levels to include biology and chemistry. What I would advise you to do is to have a look at Medical Schools Council website in the UK, which gives you an idea of some of the skills and attributes and behaviours that are necessary to work in a healthcare setting, and look at how you are developing those skills yourself. Where have you seen them demonstrated, and why are they important? What do patients want to see from their future doctors? The application process is by the 15th of October, although I will say that this year, because it falls on a Sunday, that will be the 16th of October, but make sure that you adhere to that deadline, as mostly your schools will be applying or at least sending off your application and may wish to do that before the weekend. And you'll need to complete the Biomedical Admissions Test if you were applying this year. If you are applying later on, if you're applying next year for 2025 entry, it will be a different test, and I will talk about that to you as well. You then move on to the selection process. So getting into medicine is a little bit like a series of hurdles. And the next hurdle is our selection. So you have to meet our minimum entry requirements to be eligible. And we then look at your BMAT scores. We do not look at your personal statement. It is an opportunity for you to write down and to really identify what preparation have you made for your application. And I do believe that your personal statement is a really good stepping stone for an interview as well, to read through it, to think about what experiences you have and what skills you've developed. And there may well be questions in interviews about your personal statement as well. The interviews then happen between December and March. The vast majority of UK medical schools run multiple mini interviews, and that's what we run at UCL. And if you are successful, we'll then make you an offer of an A star and 2 A's, with the A star to be in biology or chemistry. So as mentioned, it is competitive, and whilst I'm so thrilled that so many students still want to study medicine every year, we have over 3,500 applications for our 334 places. And so as much as I would like to take you all, I just simply can't. So we do rank you based upon your BMAT scores, and we tend to invite around 800 to 1,000 students to interview every year. And the interviews are done on a rolling basis between December to March. So please don't panic if you haven't heard by January or February. We are still inviting, and we will still be emailing applicants. Please note that if you are an international student, the competitiveness is probably a little higher. We have around 1,000 applications for just 24 places. And again, as mentioned, that is capped by the UK government. The minimum entry requirements are simply what we require. So at GCSE, a grade 6 in maths and English language, and at A level, an A star and 2 A's. To be achieving more than that is fabulous, but will not give you an advantage over any other applicant. And so all we look at is that you meet that minimum requirement. We do have contextual offers as well. So we know that students may well come from different backgrounds, and we would encourage you to apply to us. And so please do have a look at our Access UCL website, which has an eligibility calculator. It looks at your postcode, your school postcode, and to make sure that you are from a state school and that you come from an area of the country that perhaps is less affluent, and also that few people go on to higher education. And if that's the case, then we will make you a lower offer of AAB. The Biomedical Admissions Test. So as mentioned, this is actually being withdrawn from 2024 onwards. And so for those of you applying this October, you will need to sit it on the 18th of October. And the application deadline for that is the 30th of September. So please do note that. If you are applying in October 2024, there will be a different test for you to take, and we will let every applicant know. We will announce it on our website this summer. The average scores are available on our website, but please bear in mind that there is a different cohort of students that apply every single year. And so those averages do change and do vary. We have also put the scores up this year for those that we have ranked, and what the score was that got to interview. My advice for BMAT is to use the past papers that are available online. You don't need to go to a course to complete the BMAT. It simply requires some revision of the specification. It needs some timed activity. Do the essays in 30 minutes. And if you've got other people in your school who are applying to medicine, is talk to each other about it and talk to each other about the outcomes of the essays, for example. And work experience. So I do want to highlight that work experience is not just simply a tick box exercise. It is there for you to appreciate a bit more about what it is like to study medicine, to work with other people. But we appreciate that many of you find it very hard to gain clinical work experience, and that is not a requirement. We don't have a minimum number of days or requirement for clinical work experience. We believe that any experience is good experience. So I've put pictures there of examples of whether it might be lab-based work, going to a course, coming to an open day and practicing some clinical skills, or even paid work. And actually paid work gives you so many skills such as teamwork, perseverance, commitment, leadership, communication skills. And those are all skills that we are looking for in our future doctor. Medical Schools Council have some fantastic guidelines on their website, and I've put there the Observe GP logo because there are lots of online resources now that do give you some experience of what it is like to work as a doctor. The interviews themselves, as I mentioned, run from December to March and are multiple mini interviews. They're really not scary, so I don't want you to feel that this is a very scary thing. We all want you to do well, and we want to meet you and find out more about you as a person. There's only so much that we can gather from a paper application form and a BMAT score. Now we want to know more about you, about your motivation for medicine, about the skills that you've been developing, and what you know about the skills that are needed to work in a healthcare setting. And so my advice to you is medicine is tough. It's a tough course, it's lengthy, it comes with its own challenges, but it is brilliant. And I would totally advise you to go for it. But do some research, read medical schools websites and Medical Schools Council as well. And think about keeping up to date. Show your interest in medicine, develop that interest in medicine by thinking about what's going on in healthcare now. You already know about perhaps some of the strikes that have been going on in the UK. Maybe read a little bit more about why those are happening. Reflect on what you already do and the skills that you are developing. And for those aptitude tests, the best preparation is to do the timed practice papers that are available online, and perhaps to meet up with some other people who are also taking those tests. It is competitive, but please don't give up if it is absolutely what you want to do. And we look forward to receiving an application from you. Good luck. So on that note, I'm going to stop sharing my screen. I'm going to invite my panel of people for question and answers. So we've got Abby, who is currently in year 3. We've got Lauren, who is currently in year 3. And we've also got Dr. Lal, who is the Deputy Programme Lead for the later years of the programme. And so we're very happy to answer your questions. So I can see that there have been some in the Q&A and that you have already been answering a few. So thank you very much. So I'd like to start off with to ask Abby for some comments about the reasons why you chose to come and study at UCL Medical School.
So I attended the open day, the in-person one, back in 2019. And I already had a slight idea that I wanted to go to UCL because it was close enough for me, because I commute from home and I wanted to do that. And it's only about an hour away, so I thought that was feasible for me. But when I went to the campus, I just loved it. It sounds really cheesy, but it was a really nice sunny day, and I was sat outside the Portico building, the building in the background just there, and it was sunny and it was really lovely. Everyone looked like they were having a good time because there were still some students around. Everyone I spoke to was really helpful. They seemed like they really enjoyed it. So it just kind of affirmed it for me. Just being around the campus, getting to talk to some people from the medical school, hearing from Professor Deborah Gill, who was our old like head of the medical school. I just really loved the look of it, and came here. Obviously my first year was like COVID, so I didn't really get to come on campus a lot, but how they handled everything, I thought it was handled to the best that it could be at the time. And after that, when everything did start to come back in person, a lot of it was made up for, which I really liked. So yeah, I just really loved the campus. I love the feel of the university. But yeah, no matter where you decide to go, you'll love it. All medical schools have to be great, but I just really loved UCL. It was the best fit for me that I found. So yeah.
Thank you very much, Abby. So I hope we can persuade some people here today on the virtual open day as well that they want to come and study here. And we do have an in-person open day coming up. So if you are able to attend that, that's on the 30th of June or the 1st of July. We'd love to meet you. We'd love to see you. It was about 35 degrees over here during the open days last year. So it is a fun day and we'd love to answer your questions there. Lauren, can I ask you the same question? Why did you apply to UCL? What made you choose here?
Yeah, sure. I think there were lots of reasons why I chose UCL. I think firstly, as kind of Abby started discussing, like the location in central London is really nice. I think it's close to a lot of brilliant hospitals and really there's lots of really great places to study, like the British Library and the Wellbeing Collection right outside. I think being in a city is really nice. There's plenty to do, lots to get involved in. I think UCL being such a brilliant research university was also one of the reasons why I chose it. It means that you're being taught by people who are leading like very influential research and who really are experts in what they're teaching. And I think that's really nice. And it also means that you have the opportunity to get involved in research if you want to. And finally, I think dissection really played a big part. So there's the opportunity to do anatomy dissection on a cadaver, which is quite a rare opportunity, and it's not offered by many medical schools in the country. So when I was picking where to apply, that was one of my criteria. So I only applied to places that were offering dissection. And I found that really a helpful way to learn anatomy, and it really nicely complements the other ways that you learn anatomy. So learning through kind of textbooks and prosections, which are like already dissected pieces, like parts of the body. And yeah, so I think kind of location, research and dissection for me were like the main reasons.
Fantastic. Thank you very much, Lauren. So yes, we're very, very lucky that people do donate their bodies to medical science to allow medical students and other healthcare science students to learn from their bodies, which is an amazing privilege, and we really do value that. And we're actually having a Thanksgiving service at the end of May for those donors and their families, which is brilliant. And anatomy is very important to us at UCL. Research, likewise. So there are lots of opportunities to get involved in research at UCL, right from year one, if you wish to. In the clinical years, you can also get involved by doing quality improvement projects and audits in the clinical workplace. And as mentioned, some students like to take their IBSc further by going on to do an MB PhD. Fantastic. So the next question, I'm going to stick with Lauren if that's all right, is wider reading. So my own personal opinion of that is read something that you enjoy. You don't have to read books, but Lauren, do you have some advice for people about wider reading?
Yeah, I think that's kind of the main point, is just read. Well, it doesn't even have to be read. You can listen or watch anything that's interesting to you and that relates to medicine. I think when you find something interesting, it means that you will you'll remember it, you'll develop questions about it, and that will really come across if you are talking about it in your personal statement or if you get asked about it in an interview. And I also think it's good to kind of expose yourself to as many like things related to medicine as possible, just so that you, just more for yourself, not necessarily for your application, but just so you get an idea of if medicine is really for you. I think there are like a couple books that people always talk about, but they're not necessary to read. And so I think, yeah, just finding, like, you could listen to podcasts, watch even films or whatever it is, but find things that really kind of spark your interest and read about them in detail, and kind of ask questions about them. And I think that's fine. There are plenty of like free resources available online, and also you can go to like local libraries or your school library. You don't need to spend any money on like expensive books or textbooks. Yeah, just kind of read what you can, stay up to date with the news. I think is always helpful as well, just to give you a broader context of what's happening in the NHS and what kind of you may be involved in as like a future doctor. So yeah, I don't think there's anything like specific that you need to read. I think it's also nice for the people reading your application or who are interviewing you to kind of for you to talk about something that's not commonly talked about. So don't feel like you should just read what everyone else is reading. Like, do find things that are kind of speak to you particularly.
That's really helpful, Lauren. I would totally advocate that, is that there isn't a reading list that gets you into medical school. And just like work experience, it's not what you do, it is more about how you reflect upon those activities that we want to hear about. So how has that influenced your decision to study medicine? What have you learned from that? What surprised you about what you read? Those are the sorts of things that we want to hear from you at interview. We may well ask you a question about, have you done any wider reading, or did any of the things that you've done spark any wider reading? But it will be about what you've learned from it rather than what it was per se. Abby, there is a question about IBSC research projects. I wondered if you might just talk about which IBSC you're doing and how you're getting involved in research.
So I'm currently doing the sports and exercise medicine IBSC this year. So we do have a research project, and as far as I'm aware, pretty much all of them will have a research project or dissertation, depending on what kind of IBSC you decide to choose. So this year I've been looking at hamstring injuries in football, and we've been able to test some footballers that have come in, which is pretty cool. We get to use all of the nice equipment that they have in the lab. So we're based at the ISEH, so the Institute of Sport and Exercise Health. So it was like built after the Olympics in 2012, and it's one of like the main kind of centres in the UK, as far as I'm aware. So a lot of athletes, like patients go there as well. They have NHS clinics there as well, which is quite nice. So yeah, there's loads of research projects going on all the time. There's some quite high-end researchers and clinicians there from an MDT, which is also really nice. We get to work with physios, we get to work with strength and conditioning coaches, doctors, a lot of people at the top of their field, but it's nice to work with a variety of people in different aspects of people's medical journeys. So yeah, I've been looking at hamstring data and working with athletes with hamstring injuries. Quite prevalent in sport, so there's something that you can get involved with if you're interested in that. But all IBSCs will have different kind of basic general topics, and you can delve in further if you find something you're interested in, which is quite nice. You do have a wide kind of breadth that you're able to go into. It's not like you have to choose something that's already there. If there's something you're really interested in looking into, you're able to do it, as long as there's someone there to help you facilitate it, which I quite like.
Amazing. Thank you very much, Abby. I've been following Abby's research project while she's been helping with interviews, which has been fascinating. I'm very fascinated in your topic as well. But it is a great opportunity to be able to do some actual research in year 3. And it just gives you an idea of whether that's actually something that you enjoy. But also, I think it's important for doctors to understand the components of research and to be able to know what is going on in the background that can inform your future career. Medicine is very evidence-based practice, so it is based upon the research, and actually things change very rapidly in medicine because of research. And so it's worthwhile knowing how that comes about. So I can see that there's a question, there have been a couple of questions about accommodation. So to just let you know, at UCL guarantees accommodation for all first-year undergraduate students who have not been an undergraduate living in London before. And so you do need to apply by a specific deadline to be able to meet that guarantee. So there are some eligibility criteria. There's lots of information on the UCL website about that, lots of frequently asked questions. There are 360-degree videos of the accommodation that you can have a look at. Most accommodation is within walking distance of UCL. There are some that are a little bit further out, so some that are in Camden, which is probably about a 30-40 minute walk down to UCL, and some that are a little bit further out than that. And you're allowed to put a preference down, but you can't choose a particular halls of residence that you would like to be in. We have a selection of catered, non-catered, double rooms, single rooms, ensuite rooms, non-ensuite rooms. And so just have a look at what's out there. And obviously every university will be slightly different from that perspective. But from year 2, everyone lives out. We also have a lot of students who commute as well, who live in and around London and who commute into the programme. And they don't miss out on anything by doing that. I had friends when I was at medical school who commuted, and indeed we have a lot of people who do commute into the course every day. So the next question that I'd like Lauren to answer, if that's possible, is about the community in general, because there's a question about, is there a sense of community across wider UCL, or are medical students very separate?
Yeah, so I think as a UCL medical student, you'll be both within the UCL medical school community, but also the wider community at UCL. You're not kind of exiled, they're kind of one and the same in a way. So as Sarah kind of talked about earlier, like we have RUMS, which is the medical schools society, and through RUMS there are like kind of smaller societies that are like built on are based on a medical student's schedule. So within those societies you'll have a lot of medical students, but also people from other courses, and a lot of medical students get involved in that. But there's also the option to just join normal UCL societies, which is a great way to kind of mingle with the wider UCL community. And I think there are loads of events, like every single week we get like a newsletter from UCL, and also from we get another like separate thing from the medical school with loads of events going on. There are plenty of ways you can kind of choose how much you engage with medical students and how much you engage with non-medical students. And some people, you know, like to be very kind of stay within the medical school community, and some other people prefer to like kind of just hang out with people who are not medics, and that's kind of up to you. But there are lots of opportunities. You know, you're not going to be like isolated away from the rest of UCL. You're also based pretty much next to everyone else, so you will kind of bump into them and meet them at loads of events that are run quite generally for UCL. So yeah, I think kind of in response to the question, you're by no means isolated, but there's also a degree of flexibility as to who you kind of want to spend your time with. I think the medical school has a very tight community that you will automatically be a part of. And I mean, the same with UCL more broadly. So you shouldn't worry about kind of missing out on any sort of sense of community.
Fabulous. Thank you, Lauren. I think that's important to recognise, is that there is a strong community of students amongst medical students, without a doubt, because you're all on the same programme, you're all learning to be doctors, you're quite a large cohort, and there is a very strong student society. But at the same time, you are part of UCL. I certainly lived with non-medical students during my programme, which was brilliant. And you will mix with a wide variety of different students from different courses, which is incredibly valuable. And so alongside that, Abby, there's a question about not living in London and how does it feel to then integrate and mix in London?
So I think a lot of that is kind of up to you and what you decide to do. Obviously, if you just decide to come in, if you're choosing to live at home kind of thing, and you decide to commute and you come in and then just decide to go home at the end of the day, obviously it will be a bit different. You might not be able to make as many friends as such. You still be able to make a lot of friends, because a lot of the lectures, obviously whilst they are there for learning, they also are a good social meet up as well for everyone. I know a lot of people do tend to meet people and friends by going to lectures and all of the small group teachings. So it's definitely a good idea to get involved with all of the societies if you are deciding to commute. And just in general, if you are moving from outside of London into London, it's definitely a good idea to just kind of throw yourself in a little bit and do get involved with stuff. Because I know a lot of societies, especially in Freshers Week, they do kind of go a little bit around London as well. So you do get to go to different places in London and get to explore a little bit. And I think a useful app to have would be City Mapper on your phone, just so that you can just plug in where you're starting, where you want to go, and it will show you the routes. Just because I know there's a question on there about worrying about getting lost, but also just generally Google Maps, Apple Maps, even the Tube map, that can be really, really helpful. It can help you get from A to B as well. So it's good to have some form of map on your phone just to help you so you don't get lost. But the good thing about London is there's pretty much a bus stop on every corner. There's around UCL, there's literally, it's cornered off by tube stations. So if you way, it'll be easy enough for you to get to, and then you're surrounded by King's Cross, St Pancras, Paddington, Euston. So if you need to get out of London, if you want to go somewhere, there's no way that you'd be stuck in London. It's very accessible. So just in terms of moving into London or not being from London, try and throw yourself in at the deep end a little bit. I know it's quite daunting, but pretty much everyone is in the same position as you, even people that have lived in London. Not everyone's explored the whole of London, and if you're coming to university for the first time, you're going to be in a new situation. So everyone is in the same boat, and everyone does want to make friends. So it's easy to just turn to someone and be like, "Hi, I'm so and so. How are you? Like, what's your name?" And you'll pretty much make friends straight away off the bat. Everyone is very welcoming and friendly. You don't really get a lot of cliquiness or anything like that. It's not like people are going to turn to you and say, "I don't want to be friends with you." It's very easy. Everyone's very welcoming. Everyone's in the same position, so it's a good idea to remember that. And it's so easy to get around London that way as well. You can just say, "Do you want to grab lunch here?" And you can learn your way around campus. Once you've been around campus for like a few weeks, you get to learn it in and out. So I wouldn't worry too much about getting lost or being scared about coming. It's a very daunting situation, but everyone's in the same boat. So you'll be totally fine as long as you make the best out of the situation for yourself.
That's very reassuring, Abby. I myself came from the northwest of England down to London, from a tiny village to the big city. I mean, I found it amazing. I loved being down here, and you settle in really, really quickly. And as Abby said, there's so many other people who come from across the country and across the world who are doing the same thing, who are adapting to a new city. And it's just great fun. In fact, UCL is very near the BT Tower, which is a very tall building in London. And we used to always say, if you can see the BT Tower, you'll know where UCL is. And that was our point of direction back in the day where we didn't have Citymapper or phones and maps. So it's very, very doable. So thank you for that question. We've got 10 minutes to go, so please do pop your question in if you do have one, and we'll try and answer it for you. I'd like to come to Dr. Lowell, if that's possible, for a question about the later years of the course and what an apprenticeship means, what sort of learning happens over the clinical years.
Thank you, Sarah. Thank you for asking me to speak, and welcome to everybody. Hopefully we'll see some of you as our students. So the clinical years are years 4, 5 and 6, and these are different from the science-based years 1 and 2 in your IBSc. Those are the years where you start to go out into the hospitals. So for year 4, it's primarily the central sites that Sarah mentioned, the Royal Free, UCH, the Whittington and the Barnet North Middlesex site, and you get to spend time on the wards dealing with real patients. And we, in the 4th year, tend to concentrate on getting you skilled at examining, interviewing, taking histories and performing some basic physical clinical skills. And then year 5, it's a little bit more specialist, and you see some of the specialists, specialty patients, but also do women's health and children's health. And then in year 6, it all comes together, where we ask you to put everything together and start to act like real doctors. We use something called the apprenticeship model, and that's just as you might imagine. It means spending time with real doctors, seeing real patients, doing things, and then receiving coaching on how you did, how you might improve, where your knowledge gaps might be, where your skills gaps might be. And that builds gradually over the years 4, years 5 and year 6, so that by the time you get to year 6, you are beginning to act, to most purposes, act like a real doctor. And so our strap line for year 6 is think like a doctor and act like a doctor. So you're ready for the finals, you take your finals, and then you have a preparation for practice period and an elective period where you can really get stuck in and get yourself ready for your foundation year.
Fantastic.
And it's great fun.
It is. That is the best bit. The first 4 weeks of year 4, you start your introduction to clinical medicine, and it's a brilliant time when you start really feeling like a doctor and actually being able to assist on the wards. You're actually having patient contact and contributing to on calls and seeing patients, which is brilliant. So there are a couple of questions about finances and cost of living. Absolutely. We're in a very different situation this year than we were when we were talking about coming to university last year. That cost has gone up without a doubt in all areas. And so it is something to think about. There are scholarships and bursaries that are available to students, and I would advise you to have a look at university websites and information about finances. On UCL website, they do put an indicator about how much per week and per month they think is the average is needed of part of cost of living, which includes obviously things like your mobile phone, thinking about rent, thinking about food, clothes, etc. And so that's very helpful to look at and to give you an idea of what it costs. It's costly in any big city, to be fair. And there is a question about, can you work alongside your studies? Well, yes, you can. And a lot of our students do. I did. I worked in the university library, actually, whilst I was a medical student here, which was a great job. And there are lots of jobs that are available at the university that you can apply for. But we also employ our students as ambassadors to come and do open days, to do outreach activities, and to be ambassadors for the university. So there are certainly plenty of opportunities to do paid work as well, alongside the course. Less so when you get into the clinical years. So it is worth bearing that in mind, that in the clinical years, it is a long course. We say actually in year 4 and 5, it's the 52 weeks of the year with 6 weeks holiday. So it does become a little bit more challenging and you don't have those long summer holidays to earn money, but that will be the same across any medicine program that you take in the UK. So we're in our last 3 minutes. So I wonder if I could come to Abby and Lauren to give one top tip for applying to medical school, please. Abby, do you want to go first?
Be yourself and avoid the student room. It can be a very toxic environment when you're applying to medical school. It can potentially lead you to burnout, and you don't want to do that when you haven't even got there yet. It is a long course. It's a lifelong learning, medical school and becoming a doctor. So it's important to make sure you take care of yourself during the period when you are applying. It's quite stressful. Obviously, you might be about to do your A levels or IB, or you might just be finishing your undergraduate degree, or whatever you're going through in your life in general. So definitely avoid the student room and how people say, I got 9 A stars at GCSE, I got 3 A stars at A level, I got this in my BMAT, this in my UCAT, I did all this work experience. Because it's not necessary. As we've already mentioned, you just need to meet the minimum entry requirements. Not everyone will be able to get clinical work experience, but any work experience is good work experience as long as you say what you've got from it. So just do what you can and just enjoy the process as well, because it is a nice thing to do and it does set you up for life as well, just in general, like interviews, interview prep, just things like that. So just be mindful of yourself, look after yourself, and avoid student room as much as you can.
Brilliant. Thank you very much, Abby. Some good advice. Lauren, have you got some top tips?
I think Abby just stole what I was going to say, but yeah, pretty much the same thing. I think try and be confident in your own abilities. I think it's really easy to kind of, as Abby alluded to, like compare yourself to other people. It can be quite a intense and toxic kind of environment, especially online. So I think just really looking after yourself, and yeah, believing in yourself, like you've all done, you know, a lot at this point, and like you'll continue to achieve really well. So like don't be too worried, and really enjoy the chance to explore something that you're passionate about, and be excited, because I think, you know, like even if it might take you a few attempts or whatever, but I think hopefully if you do become a medical student, it will be worth it. So yeah, I think just like keep going, and yeah, just look after yourself.
Fantastic. Thank you ever so much, Abby and Lauren, for your comments and helpful advice. Medicine is brilliant. If you have the passion for it, the motivation for it, and an understanding of what the career might look like to you in the future, then go for it. You don't have to be scoring lots of 9s, lots of A stars at A level. You just need to meet our minimum entry requirements to be able to apply to us. And so go for it. You can do this, and we believe in you. And so believe in yourself, and come and find out more about our medicine degree programme on our website and at our open days. Thank you ever so much for joining us today, and I hope that that's been useful. Bye-bye to you all.